Welcome back to our channel. Today, we're diving into a topic that confuses many Medicare beneficiaries, the infamous donut hole in Medicare Part D. We're going to break down the donut hole in Medicare Part D. Our goal is to make this confusing topic a little sweeter and easier to understand using a donut analogy. First, let's talk about Medicare Part D. Medicare Part D is the prescription drug coverage portion of Medicare. It helps cover the cost of prescription medications, which can be a significant expense for many seniors. Now, what exactly is the donut hole? Officially known as the coverage gap, the donut hole is a temporary limit on what the drug plan will cover for your medications. The amount resets at the end of the year. It exists to share costs between you, your drug plan, and Medicare. Some plans may have deductibles where you must pay the full amount of cost for prescriptions. Some plans offer no deductibles, and for some plans the deductible may only apply to certain prescriptions. When it is reached, the plan will begin covering you. Imagine a donut. The donut itself represents the initial coverage phase. When you first start using your Part D plan, you pay a portion of the costs, such as co-payments or co-insurance, and your plan pays the rest. This continues until your total drug costs, including what both you and your plan have paid, reach $5,030. This is the cost for 2024, and it will reset on December 31st of each year. The amount can also change from year to year. Once you and your plan have spent $5,030, you enter the donut hole, or coverage gap, represented by the hole in the middle of the donut. In this phase, you will pay a higher percentage of your prescription drug costs out of pocket, 25% for both brand name and generic drugs. Let's break down the donut hole stages using our donut analogy. First, we have the initial coverage phase. This is like the donut itself. You share the costs with your plan until you reach $5,030. Next, we enter the coverage gap, or the donut hole. Once in this phase, you pay 25% of the cost for your medications out of pocket. Finally, we have the catastrophic coverage phase. After your out-of-pocket costs reach $8,000, you exit the donut hole and enter the catastrophic coverage. In this phase, you pay significantly lower co-payments or co-insurance for the rest of the year. Here are a few tips to help you navigate this phase and minimize costs. First, consider generic drugs. They are typically cheaper than brand name drugs. Next, look for pharmaceutical assistance programs. Some drug manufacturers offer programs to help with costs. Also, consider switching plans. During the annual enrollment period, review your plan options and consider switching to one that offers better coverage for your medications. Another option is to apply for Medicaid within your state. If approved, you will automatically qualify for extra help or low-income subsidy, also known as LIS, through Social Security, which will pay the majority of the cost for prescriptions. For 2024, the majority of people who qualify will pay between $0 to $4.60 for generics, and between $0 to $11.20 for all brand name prescriptions. All prescriptions must be covered under your prescription drug plan's formulary. Lastly, you can apply for LIS or extra help directly through Social Security. If you do not want Medicaid, or if you do not qualify, you can contact Social Security directly to apply for the program. The income qualification is different from Medicaid, so please contact Social Security for more information. There are a few common misconceptions about the donut hole. For example, some people think they must pay the full cost of their medications in the coverage gap. That's not true. You pay 25% of the cost for both brand name and generic drugs. Another misconception is that the coverage gap lasts all year. In reality, you exit the gap once your out-of-pocket costs reach the specified limit. Navigating the donut hole can be challenging, but being proactive can make a significant difference. Here are more tips and strategies to help you manage your medication costs effectively. First, use preferred pharmacies. Many Medicare Part D plans have preferred pharmacy networks where you can get medications at lower costs. Check if your plan has preferred pharmacies and use them whenever possible. Second, review formulary changes. Each year, Medicare Part D plans can change their formularies, which is the list of covered drugs. Review your plan's formulary annually to ensure your medications are still covered and to see if there are any new alternatives that could save you money. Third, ask about drug substitutes. Talk to your doctor about the possibility of switching to lower-cost alternatives, such as generic drugs or therapeutic equivalents, which can be just as effective as brand-name drugs. Fourth, split pills when safe. Some medications can be safely split to save money. For instance, if your medication comes in a higher dose than you need, your doctor may prescribe a higher dose tablet that you can split in half. Always consult your doctor or pharmacist before splitting any pills. Fifth, use mail-order pharmacies. Many plans offer mail-order pharmacy services that can provide a 90-day supply of medications at a reduced cost compared to a retail pharmacy. This can be a convenient and cost-effective option. Sixth, track your spending. Keep track of your prescription drug spending throughout the year to anticipate when you might enter the coverage gap. This can help you budget and plan for higher costs. Seventh, take advantage of free screenings and vaccinations. Medicare offers free preventive services, including screenings and vaccinations. Staying healthy can reduce your need for medications and help you avoid higher drug costs. Finally, stay informed. Policies and coverage rules for Medicare Part D can change. Stay informed about any updates or changes to the program that might affect your coverage and costs. Understanding how costs are calculated is essential in the different phases of Medicare Part D. So, let's break it down. In the initial coverage phase, you pay a copayment or coinsurance for your prescriptions and your plan pays the rest. For example, if your plan has a $10 copayment for generic drugs and a $35 copayment for brand-name drugs, you pay these amounts until your total drug costs, meaning what you and your plan pay, reach $5,030. Next, we have the coverage gap, often referred to as the donut hole. Once you enter this phase, you pay 25% of the cost for your medications. For instance, if your medication costs $100, you will pay $25. The manufacturer discount and plan payment will cover the rest. Finally, there's the catastrophic coverage phase. After your out-of-pocket costs reach $8,000, you pay a small copayment or coinsurance amount for your medications for the rest of the year. This could be as low as 5% of the drug cost or a fixed dollar amount, whichever is greater. Being prepared for the donut hole can help reduce stress and financial strain. Here's how you can plan ahead. First, estimate your costs. Use the Medicare Plan Finder tool to estimate your yearly prescription drug costs based on the medications you take. This tool can show you when you might enter the coverage gap and your potential out-of-pocket costs. Also, individual insurance companies offer a prescription drug tool as an estimate as well. You can view this information online on their website or by contacting an insurance agent. Next, budget for higher costs. Set aside funds in your budget to cover the higher out-of-pocket costs during the coverage gap. This can help ensure you have the money available when you need it. And finally, look for cost-saving opportunities. Explore all available options to save on medication costs, including discounts, coupons, and assistance programs. Don't hesitate to seek help from community resources that can provide additional support. State Health Insurance Assistance Programs, or SHIP, offer free counseling and assistance to Medicare beneficiaries. They can help you understand your coverage, compare plans, and find cost-saving opportunities. Local senior centers can also be a great resource. Many senior centers offer resources and support for navigating Medicare. They may also host informational sessions and workshops. And let's not forget about pharmacists. Your local pharmacist can be a valuable resource for understanding your medications and finding lower-cost alternatives. To summarize, we discussed the basics of Medicare Part D, the concept of the donut hole, and how it impacts your out-of-pocket costs. Remember, the donut hole is just a temporary phase in your drug coverage, and there are ways to manage and minimize your costs. If you have any questions about Medicare Part D or the donut hole, please leave them in the comments below. We're here to help you navigate your Medicare journey. Thank you for watching. Don't forget to like, share, and subscribe for more informative content on healthcare topics. See you next time.